I'm very happy to be here. I remember coming to these summits back when I was at Columbia and getting more involved in HITLAB. But in terms of my path to working in this space, to working at Maven, I was always interested in healthcare, but didn't know exactly what that meant. I actually never wanted to be a clinician, which I feel like is divergent from the typical story of people who work in healthcare. But I was really interested in health policy, health equity, science journalism, focused on a lot of that during my undergrad. Realized I wanted to really focus on building and scaling solutions to issues I cared about. And for me, as a first step, that largely took the form of learning business acumen. You don't know very much as an undergrad. So I spent the first 4 years of my career as a management consultant, working across industries, learning how to work, and then pursued my MBA here at Columbia University, and really took that time to explore healthcare broadly defined. I did global health work. I had an internship with New York City Economic Development Corporation. I worked in health tech, but due to some of my professors, some of my classes, by the end of that experience, I realized I really wanted to understand how value-based care was operationalized. So what does that actually mean outside of something that's just written down on the page? So I took a role at Mount Sinai Health Partners here in New York, which is the commercialization team of the system that's focused on building specialty care bundles and helping transition clinics from fee-for-service to value-based models. It was an awesome experience. Learned so much about healthcare, but also knew that I always wanted to be at a venture-backed startup, a digital health startup, focused specifically on care model design, new models of care. So 4 years ago at this point, which is wild, I made the jump to Maven Clinic to build and scale all of the internal teams and infrastructures required to deliver virtual services, to operate a now multi-hundred network of providers across 30 plus specialties in all states in 175 plus countries. So it's been a wild ride, and I'm happy to talk a bit more about that.
No, please do. I think, one of the things that everyone in the room and certainly around the world watching have been so impressed by Maven is its adoption, and just seeing patients from all over, not just the country, but around the world, using it as a platform, not just during the pandemic, but after the pandemic as well. Talk a little bit about Maven's meteoric rise in the US and then its rise around the world too.
Yeah, definitely. I will say the member stories are certainly what's most motivating, helping people have access to care. So Maven, the problem it's trying to solve is access and outcomes. And I know I spoke a bit about this, but at its core, Maven is the largest virtual clinic supporting women's and family health. So what does that actually mean? A member that has access to Maven through its health plan or employer can meet with over 30 specialties that span kind of the more medical specialties you might think about, OBs, pediatricians, reproductive nurses, but they also have access to lactation consultants, sleep coaches, which is always popular with the new parents, nutritionists, physical support coaches, all in one place. You can engage with these specialists whenever you want, asynchronous care, synchronous messaging, or synchronous visits rather, and also have access to content, community, and now even a financial platform where all of your applicable covered benefits can be managed by Maven. So it's really this platform that supports you no matter where you are on your family planning journey. And this is really powerful when you think about how fragmented access is within the US particularly, and even just wait times. So I think the last time I looked, the average wait time to see an OBGYN in a US county was 30 days. You can see an OB on Maven in 30 minutes. And obviously it's never going to replace your in-person care. Like our chief medical director our medical officer likes to joke, you can't deliver a baby through a screen, which will always be true. But you have tons of questions in between, whether it's an actual second opinion or really wanting to calm your nerves in the middle of the night.
That's good. You'll have to look up Teleview. Ryan, if you can talk to Jamie afterwards, Teleview is the AR/VR company that has goggles that a person can wear, and the doctor sits on the other side of them, thousands of miles away sometimes, on a computer screen, helping the physician do a surgery maybe they've never done before, not just around the US, but in Canada and around the world. So tell us a little bit about some of the vision of what Maven looks to do over the next 5 years. Obviously, it's an industry leader. It's a vector leader within the 12 different vectors of digital health. HITLAB has identified it as one of the vector leaders for telemedicine and remote patient care. What's the vision for this over the next 5 years?
Yeah. So Maven has worked so hard to expand care and access across the family planning journey. So I think when we originally launched, and we're 9 years old officially at this moment, it was really focused on maternity, and that expanded to parenting and pediatrics, and now we recently launched a menopause product and are very focused on fertility as well. So it's how do we deliver all of that care in structured care programs that actually drive the outcomes that we want to achieve. And those outcomes can be financial and cost savings. They can also be more clinical, like reduced unnecessary C-section rate, reduced NICU stays, improved mental health scoring. So I would say delivering all that care with excellence is where we are going, and making specific investments in our fertility product, and actually continuing to evolve our fertility network offering, and really leaning into international expansion. We already serve members, as mentioned, in over 175 different countries, and this requires a lot of operational nuance, whether it's content translation or in-country recruitment of providers. So again, getting that all, not even getting it right, but getting it excellent is really where the focus is.
So it really is that virtual care model that we've been talking about. We saw explode during the pandemic, and a lot of the folks in the room here see virtual care as not necessarily something that's going to boom overnight or something like that, but it is going to replace a lot of what we see in healthcare over the next 10 years. Yep. So a lot like managed care from 1990 to 2000, where managed care in 1990 was very infrequent, maybe 5% of the adoption rate. By 2000, managed care was almost 100% of US healthcare delivery. Is that what you see for virtual care and Maven over the next 10 years? By 2033, are we going to be looking at a largely virtual relationship?
I don't know about largely virtual, because my personal opinion is that it does very much vary on the specialty, the condition, the relationship between a person and their holistic care team. I do think that telehealth is certainly here to stay. I think what we've been seeing is an exploration of what that means. So telehealth is this concept, and now you have synchronous care via visits, you also have via phone, you also have investments in asynchronous messaging, and I think the whole point is meeting members where they're at, and we've seen definite preferences for, do you want to be on video, do you not want to be on video, do you want it to be a message? So I think it will definitely keep growing and keep reflecting member needs and member desires.
And talk about these two outcomes, these two variables, outcomes and access yeah. And outcomes, great variables, and so important to public health and public health equity. Yeah. And tell us a little bit more about what Maven has seen as it's grown internationally, about really meeting a lot of those outcomes and those expectations.
Yeah, so I mean, the holy grail is how do you drive the clinical outcomes, financial outcomes, member experience outcomes. Everyone is working towards that. And sometimes there is tension. Sometimes a lot of investment is required to actually achieve the outcomes you want with regards to social determinants of health. We have tons of companies working on that. I think for us, the women's health space and the fertility space is interesting, because for a long time it was also very, very underserved, and continues to be. And I think there is investment in, for example, menopause, putting a care plan out there, making sure that people who typically feel unheard in the healthcare system, haven't had the resources they need, are getting access to specialists, feeling comfortable enough to ask the questions that they have, feeling heard, being counseled on the trade-offs of different paths forward, hit not only the actual clinical outcome of reduced stress, improved mental health scores, improved productivity, and then it's also just the member experience satisfaction outcome that we all look to strive as well. And not that I often think is forgotten, but I want to hold that up as a outcome here, right? Like, what was the member experience throughout this process, not just what's the clinical outcome and the cost outcome.
Yeah, and that's really something that we're seeing develop now more slowly than maybe 2 or 3 years ago, but still developing, is this new kind of outcome and what kind of outcomes are being measured. Talk a little bit about some of the key outcomes that you've seen Maven tracking, and how you're really proud of those outcomes and how they differentiate what Maven's doing from maybe some other types of frameworks and groups that are out there?
Yeah, certainly. So Maven has made really heavy investments in our research team, which I'm very proud of, small and mighty. And when you talk about outcomes, I think there's a number of flavors, but really claims analysis is kind of the holy grail. So when you have a large enough client base, you can look at all the reported data, and we've seen drastically improved scoring, again, around mental health, around reduced NICU days, around reduced unnecessary C-sections. So there's kind of a few outcomes that we more closely track as it relates to women's health and family planning. But we've seen such strong improvement, which is so encouraging, particularly, again, through these holistic care plans, where I should also mention, if you're a member on Maven, when you first come into our platform, you go through a series of onboarding assessments, which will flag you for higher risk for certain areas. It might be preeclampsia, it might be mental health, postpartum depression, and then you'll be surrounded with a care team at Maven that supports all your needs. It might be a nutritionist, an OB, a mental health provider, and then you also have a dedicated care navigator, care advocate that will really quarterback your journey. So they're your very first point of contact at Maven, and will go through all your questions, all your concerns, help connect you to care, and again, be with you along the whole way. And I think this is really powerful also because it's an opportunity for that care advocate to learn more about your personal preferences. Maybe you have specific dietary needs or dietary concerns and want to meet with a nutritionist that specializes in that specific area, or you want to connect with a sleep coach that really holds up one method over another, so they can really make sure that you're able to meet with a provider that resolves your issue and meets you where you are.
That's amazing. We have a few minutes left, and it'd be great to, kind of drawing the line from, undergrad to graduate school here at Columbia, and working with folks as brilliant as Carrie Chan from the business school, and then to where you are today. Soho MD has actually sponsored a group of scholarships for students and grad students and the high school students, even from the New York City area, to attend today. So for those students that are out there, what would you say to them as you saw your journey move into healthcare and digital health ultimately? What kind of words of inspiration and vision would you tell them to think about as they're looking at their career paths, and why digital health might be a good option for them?
Yeah. I would say everyone that's in healthcare really wants to be here. It's a hard business, but it's so motivating to be working with people who really care. Like, so motivating. And at the end of the day, everyone I work with is here for a reason, and I would not trade that for the world. I'm still very close with people from Columbia. I was actually emailing with Carrie Chan last week about connecting one of her current students to an open position I have at Maven. So yes, there's kind of like the pure play networking side of the house, but even just surrounding yourself with people who can bounce ideas off, have a sounding board, and just kind of like up-level your path through the world is invaluable.